Hi, my name is Julie DeRose, and I am from Open Doors Psychology. I wanted to make a little video, especially for those individuals who have yet to be to counseling, and go over what your first session might look like. So typically when you book, you would be sent an informed consent. Informed consent is going over the process of therapy, any risks, benefits, confidentiality clauses. So just make sure you read over that carefully. Typically in your first session, you'll go over informed consent, especially the key points in terms of when confidentiality would be broken, such as if there's any risk to self, to others, anything in regards of suicide. If there's any disclosure of that during therapy, your therapist does have a legal obligation to inform whether it is your next of kin, if it is calling 911 on your behalf, just to make sure that everybody is safe. So that is the informed consent, and there's more to it, but this is what you will go over in your first session. In your first session, you'll also go over any type of symptoms that you have been experiencing. So how long the symptoms have been there, have they been around since childhood, or maybe they're more recent because of changes going on in your life. So the therapist will ask questions about symptoms. They might ask things about sleep, appetite. Another thing that I like to go over is when your last medical appointment is or was. And the reason for that is to have a baseline of your health. Some people don't realize that your mental, physical health is all wrapped into one. So by going to your doctor prior to starting any therapeutic journey, can rule out anything that could be going on physically in terms of symptoms. For instance, your thyroid. Your thyroid can increase heart rate, or it can make you feel fatigued. These symptoms sometimes can manifest in other ways, of course, but it's just good to know, right, in terms of where you are at baseline for health. And then it's a nice starting place in terms of making some goals for your therapeutic journey. In addition, in your first session, the therapist will learn about you, learn about if you're a kiddo, where you go to school, what your friends are like, all that kind of stuff. If you are an adult, the therapist will probably talk about work-life balance, maybe ask some questions about family or any history with relationships, just trying to get an overall comprehensive view of the person or people sitting in front of you. Some things that I like to consider in the first session is understanding the person, who they are in different areas of their life. So for instance, who is the person when you are with your friends? What is that person like? Who is the person when you're at work? Who is the person when they're alone and in their thoughts? Those are things that are that stand out to me, because if there's incongruencies in those, it can make us feel pushed and pulled. And I know we do wear many different hats, especially as adults and people who are juggling work, school, children. There's so much to do and really so little time in our days. So in your first session, you want to be paying attention to how relaxed, how comfortable you are with this person, because that is really important in the therapeutic journey. I think relationship and connection are key to making progress in your goals, because if you don't feel comfortable with that person, how are you going to want to open up? So some things to consider for you is that, would I feel comfortable with this person? Can I share with this person? And also be checking in with yourself after the session. How are you feeling? What thoughts are popping up? It is always nice to keep a little log, either on your phone or in a journal, of some of these thoughts. So then in your next therapy sessions, you can go over them. Now, sometimes people ask, how often should I book? Well, it really depends. For some people, it's nice to get the momentum going, to book once a week, and then maybe space it out a little bit. Sometimes every 2 weeks, every 3 weeks, it just really depends. So this is something to explore with your therapist as well. And I know there's many other things to consider, but what I really want to get through is that the first session should feel maybe a little awkward at first, that's for sure, because you're coming into a new space, especially if you haven't met the person before. So doing that 15-minute free consultation, either with Open Door Psychology or with other practices, is really good to get a feel of the person who you'll be sitting in front of, whether it's virtual or in person. And that this time is really for you. It's really for you to focus on you and the things that have brought you into session. So I hope that helped. But if you do have any questions or want to reach out further, please send me an email or you can give me a phone call and I'm happy to connect. Take care, and I look forward to meeting you soon. Bye.